The Affordable Care Act, presented by Stephanie Garay, a presentation on healthcare in America as a partial fulfillment of Sociology 335 Social Problems at California Baptist University. America is currently using a mixed private-public healthcare system. Americans are expected to purchase private insurance and generally do so based upon their financial ability and affordability of a plan. Some employers offer health insurance, allowing their employees to benefit from group rates. The employer will often pay some or all of healthcare premiums in this private system. Public health care has only been offered in America to the elderly and disabled through Medi-Cal and Medicaid. Some children are covered based on federal and state poverty programs. Those Americans falling somewhere between affording private insurance and qualifying for public insurance are left uncovered. Here are a few statistics on the healthcare crisis in America. 31% of adults and 54% of children do not have a primary care physician. 16% of Americans are uninsured, which is roughly 46.6 million Americans, 2/3 of which are gainfully employed but unable to afford insurance. America has the highest infant mortality rate among industrialized nations. Federal healthcare spending in 2005 totaled more than $600 billion, which is 1/4 of the federal budget. 51% of adults receive less than the recommended preventative care and screenings based upon their age and sex. And nearly 100,000 Americans die annually from medical errors. This is twice as many deaths as those caused by car crashes. Healthcare is a social problem. The unequal probabilities of Americans having good health and good health care contradict the value of equality. Poor physical and mental health is induced and perpetuated due in part to other social factors. The issue of health care overlaps with many other social problems within this country, such as the dependence and treatment of alcohol and drug abuse, the proliferation of crime, delinquency, violence, concerns of sexual deviance and sexually transmitted diseases, the aggregated effects of those living in poverty, those unemployed, and those combating family problems. Illness impacts interpersonal relationships. It interferes with personal freedoms, and it costs the individual and the nation economically. Everyone agrees we want a healthier America. The debate is, how is this to be achieved? The current national solution, still under much controversy, is the Patient Protection and Affordable Care Act, more commonly referred to as Obamacare. In March 2010, President Obama signed comprehensive health reform. The law makes preventative care accessible and affordable for many Americans. The act will ensure that all Americans have access to quality, affordable health care and will create the transformation within the healthcare system necessary to contain cost. It will provide coverage to more than 94% of Americans while staying under the $900 billion limit that President Obama has established. The Patient Protection and Affordable Care Act will accomplish a fundamental transformation of healthcare and insurance in the United States through shared responsibility. Systematic insurance market reform will eliminate discriminatory practices such as pre-existing condition exclusions. Achieving these reforms without increasing healthcare insurance premiums will mean that all Americans must be part of the system and must have coverage. Tax credits for individuals and families will ensure that insurance is affordable for everyone. The Act promises to eliminate lifetime and unreasonable annual limits on benefits, to provide rescissions of healthcare policies, to provide assistance for those uninsured due to pre-existing conditions. It requires coverage of preventative services and immunizations. It extends dependent coverage to the age of 26. It develops uniform standards for coverage documents, and it establishes an internet portal to assist Americans with coverage options, once again, making accessibility easier. The plan to make coverage affordable is as follows. New refundable tax credits will be available for Americans with incomes between 100 and 400% of the federal poverty line. Out-of-pocket maximums are reduced to 1/3 for those with income levels between 100 and 200% of the federal poverty line. Credits are available for eligible citizens and legally residing aliens. A new credit will assist small businesses with fewer than 25 workers for up to 50% of the total premium cost. In a shared solution, there must be shared responsibility. Beginning in 2014, most individuals will be required to maintain minimum essential coverage or pay a penalty of $95 in 2014. As you can see, that penalty will increase year after year. For those under 18, the penalty will be 1/2 the amount for adults. Exceptions to this requirement are made for groups such as religious objectors, those who cannot afford coverage, Indian tribe members, those who receive a hardship waiver, individuals not lawfully present, incarcerated individuals, and those not covered for less than 3 months. Here is a very clear and concise comparison of the pros and cons of Obamacare. Advantages are increased access to health care for the young, the elderly, and the poor. Accessibility is granted to these groups by way of government subsidy. With more coverage, we can expect more routine preventative care, which will in turn reduce the need for more significant care of disease and illness, which we know comes at a much higher cost. The plan generates additional revenue through taxation and fees, which should help to reduce the national budget deficit. On the flip side, some disadvantages are those who remain uninsured will continue to face additional burdens, primarily taxes. Individuals making over $200,000 or couples with incomes over $250,000 a year will pay higher taxes to offset the total cost of the program. Medical expense deductions on federal income taxes are going to be reduced, and the increased accessibility will lead to a severe shortage of healthcare professionals and facilities able to treat and care for the people. Lastly, drugs will be coming at a much higher cost due to increased regulation on pharmaceutical companies. The argument for adopting the act. Obamacare will reduce the number of Americans living without health insurance, specifically the disadvantaged. It will provide more people with simple preventative care. It's expected to reduce the number of people suffering from chronic diseases and illnesses, raising the overall health of our nation. And it should prevent the premature deaths as a result of lack or poor care. On the rebuttal is the case to refuse Obamacare. Placing a government mandate on health care contradicts the American right to individual freedoms and creates an unwelcomed precedent. The imposition of higher taxes to some social groups will increase the gap and hostility between already differing social groups in America. The increased burden on the healthcare system will decrease as professionals will be inundated with work. The country does not have the bench of qualified candidates to support the increased demand for doctors and nurses. In conclusion, the Affordable Care Act addresses the nation's want and need to increase the number of Americans insured and to create a healthier American. However, the plan fails to account for the increased demand on the healthcare industry and the rapid rate of burden on the individual and the small business owner. On January 1, 2014, more Americans will have access to health care, but America will not be prepared to treat those people. More Americans will be paying for subpar care, receiving less than the full value of their investment, and perpetuating their dissatisfaction with this nation and its rise of social problems. America's health did not deteriorate overnight, and it cannot be fixed overnight. More preparation must be done before a universal health plan can truly benefit the nation. Here is a brief list of references used within the presentation for support and research.